Ramkupa, the MEC for Health in Gauteng. I can see that many of you were with us since in the morning and also in the last session of the Premier's dialogue with patients. And as it has been announced, the Premier's dialogue with the staff will happen immediately after the session. Today, it is befitting that we are in the Center of Excellence for the management of TB in our country, which is a global center of excellence. And I want to extend my greetings and acknowledgement to I also would like to acknowledge the ambassador of Japan, who kindly has joined us for a program that the minister will speak more about, Ambassador Hiroki. I would also like to acknowledge the director, the country representative for the World Health Organization amongst us, Dr. Rafuro Chatora. I would also like to acknowledge the leadership of civil society, Steve Litsike, who is a SANAC deputy chair. She actually deputized our deputy president Cyril Ramaphosa. We were just chatting with Ms. Litsike, minister and premier, that perhaps we should consider renaming SANAC and the Premier AIDS Council to the South African National AIDS and TB Council, so that TB should not be a stepchild as well. And that the Premier's AIDS Council should be the Premier's AIDS and TB Council, because indeed there are many who have TB and do not have AIDS, HIV infection, although we acknowledge that there's a high comorbidity rate of about 73% between HIV and TB. But TB also has comorbidities with other diseases, as the minister shared with us. So with that, I also want to acknowledge the co-chair or deputy chair of the Premier's AIDS Council, Reverend Neo Moerane, who's also with us, the CEO of Sizwe Hospital, Dr. Lowe, representatives of National Health who are here, as well as provincial health, and our municipalities. Ladies and gentlemen, we want to welcome you and thank you for being here. Mine is a responsibility to facilitate this program, and we will be releasing the minister so that he can join a discussion with the other ministers, especially in Africa, to deal with the issue of the malaria in our continent. I will ask, so we will change the program a bit. The theme for this World TB Day, the World TB Day, as you can see, is joining the mass TB screening and uniting to fight TB by 2030. Is it possible to defeat TB by 2030? It will be possible if me and you acknowledge that TB is each one's business. With those few words, I would like to, as I've announced, we'll adjust the program to suit the minister. I will ask His Excellency, the Ambassador of Japan, Ambassador Hiroki, to come and make a few remarks as the first speaker for today. Let's give him a round of applause. Thank you, Ambassador.
Thank you very much. Honorable Minister Aaron Motsoaledi, Honorable Premier David Makula, Honorable MEC Gwen Lamagopa, Honorable Mayor Herman Mashaba, Mr. Masuhiro Yoshitake, Executive Operating Officer of Otsuka, distinguished guests, ladies and gentlemen, good morning. I'm honored to be a witness to today's inaugural ceremony of the Delaminid Clinical Access Program, DCAP. As all of you know, today is World Tuberculosis Day, when we reaffirm our strong commitment to the fight against TB. According to a report released by the World Health Organization last year, 1.5 million people died of TB, and it has surpassed HIV/AIDS as the world's deadliest infectious disease. South Africa is one of the countries suffering most severely from TB, especially from multi-drug resistant TB, MDR-TB. Delaminid, developed by Otsuka Pharmaceuticals, is one of the only new anti-MDR-TB medicines in recent decades, and it is effective for patients co-infected with HIV/AIDS and for children. The DCAP gives the patients the chance to have access to Delaminid before its official registration. I believe that this will be a significant step toward eradicating TB in South Africa and beyond. Japan has been playing a major role in global health, and last year hosted two important conferences to promote these critical issues. Firstly, Japan, as a chair country of the G7 summit, took the initiative in leading the discussion on global health by releasing the G7 Iseshima Vision for Global Health. Japan also expressed its commitment concretely through its contribution of 1.1 billion US dollars or 13 billion rand to the Global Fund and other international health organizations. Secondly, TICAD, the Japan-Africa Summit meeting, was held in Kenya last year, being hosted on the African continent for the first time. Health was one of three main themes at the TICAD meeting, in which the Honorable Minister Motsoaledi proactively participated together with His Excellency President Zuma. Japanese Prime Minister Abe announced that more than $500 million or 6 billion rand out of the fund amount pledged at the G7 summit meeting will be allocated towards strengthening health systems in Africa. He also emphasized the importance of universal health coverage, UHC, and pledged to support expanding UHC in Africa. I'm glad to say that JICA has dispatched a Japanese UHC expert to the Department of Health to advise officials to help the NHI be a success story. Director General Matsuo also visited Japan this month to get a deeper understanding of the Japanese experience of UHC. Delaminid is another example of Japan making a contribution to strengthening public health of Africa. Delaminid has been approved in some countries in Europe and Asia, including Japan, and it has been listed in the WHO's model list of essential medicines. The safety and efficacy of Delaminid has already been proven by a series of clinical tests, and Delaminid is now available over 100 countries through the Stop TB Partnership and Global Drug Facility. Now, Otsuka Pharmaceutical Company is going to commence the official registration process of Delaminid here in South Africa. I'm confident that Delaminid be a ray of hope for all the TB patients and contribute to the eradication of TB from South Africa and beyond. Now, I would like to present a box of Delaminid to Minister of Health, Honorable Minister Aaron Motsoaledi. Thank you very much.
Thank you. Can I open it? Oh, yes. Oh, yes.
Colleagues, the minister will talk more about how South Africa will use Delaminid. But I think let's give the partnership, the global partnership against TB and the contribution of the people of Japan, a round of applause to partnering with all of us. Thank you very much. We also want to acknowledge the researchers that have really put a lot of effort, and not only to prioritize the diseases of the rich, but also the diseases that are afflicting the poor people. Volvo NJ883, the request by the hospital is if you could please move your vehicle, is blocking the functioning of the hospital. Volvo NJ883. Thank you very much. At this point in time, I'm going to waste no time but to call to the stage again our Honorable Minister, Dr. Aaron Motsoaledi, who's also a global champion to fight TB in the world. Thank you very much. Let's give the Minister a round of applause.
Thank you, Program Director and MEC for Health in the province of Gauteng, Dr. Gwen Ramogopa, Honorable Premier of the Gauteng province, Mr. David Makura, Ambassador Hiroki of Japan, Ms. Steve Litsike, Deputy Chairperson of the South African National AIDS Council. We also have among our midst Dr. Chadora, who is the Country Director of the World Health Organization. Maybe let me take this opportunity to introduce him. He's the only one who was not introduced. Dr. Chadora, please. And Mr. Musihiro Yoshitake, Executive Operation Officer from Otsuka Pharmaceutical Company, who manufactured, yes, who are the manufacturers of this drug that has just been presented officially to me. Leaders of civil society, the staff here at this Sizwe Hospital, one of our best facilities in Gauteng, as the Premier has said. Ladies and gentlemen, good morning. Robert Koch, a physician from then Prussia, utilized a new staining method and applied it to sputum of TB patients, revealing for the first time the organism that causes TB, which was then called Mycobacterium tuberculosis. This revelation by Robert Koch was made on the 24th of March, 1882, in a famous lecture which was published 3 weeks later. Since 1882, the 24th of March has been known as World TB Day, and is commemorated throughout the world. And that's why today, because it's the 24th of March, we are here at Sizwe Hospital. But the official commemoration will be held in Bloemfontein next week, Friday, because the Deputy President of the country is supposed to officiate and is unfortunately not available today. I had many patients this morning during the Premier's dialogue talking about my sputum being negative or, I don't know how many of you understand that negativity, but let me show you what Robert Koch saw in 1882 when he took a sputum of the person with TB and stained it and looked inside the microphone. Sorry. The microphone is this one. The one he looked into was a microscope. You can't look into a microphone. When he looked into the microscope at the sputum of a person with TB, this is what, because I can't speak there, I want you to see what I'm showing you. This is what he saw. Yes, it's not working. But I want to demonstrate to you that what Robert Koch saw is what you see here on my thigh. Do you see the red things? Yes, that's mycobacterium. The bigger things you see there are the white cells inside the person's sputum. This is not a drawing, it's a picture from a microscope which was done, yes, not a joke, which was done by the Center of Disease Control in Atlanta in America. They presented it to me. As I told you, I'm the chairperson of the Stockkeeper Partnership, and they presented this to me. So when people said my sputum was positive, it means in that sputum you see the red things. If you put them on treatment and you keep on taking the sputum and looking at it in the microscope, then the red things disappear, then that sputum is negative. This is what Robert Koch did for us in 1882 on the 24th of February. I just want you to understand, these are not theories. So what I'm wearing here is not a snapshot, it's not a drawing. Nobody drew it. It's what was pictured on the sputum of a person who has got TB. We in South Africa, we register 13,000 patients with MDR-TB and 1,000 patients with XDR-TB per annum. I'm sure you heard during the Premier's dialogue the sharp focus that, unnecessarily befall some of our compatriots in the country. And I'm happy that some of them said they will become ambassadors to make people understand. Several factors contribute to resistance to TB drugs. It includes late diagnosis. And I want to assure you, as I said in the 10 there, that South Africa is the only country that has got 100% coverage of gene expert technology. Gene expert is that technology that diagnoses TB by identifying the DNA of the TB organism in somebody's sputum, whereas microscopy was identifying the organism itself. Since we had gene expert, we are able to diagnose more people than we used to do before. In other words, there used to be lots of people with TB, but we did not even know about them because the diagnostic tool we are using for 50 years, for that matter, was microscopy. Now, the medical response to TB has also been very slow. We had believed around the whole world that we have defeated TB. We had thought so. And we did not change anything. We did not change the diagnostic tool, not even the treatment, for a period of 50 years. when we woke up to realize we are in trouble, because it's only recently that a new drug, this bedaquiline, which everybody was speaking about, which is so effective that 79% of the people become sputum negative within a very short space of time. Whereas with the conventional treatment that has been there for the past 50 years, it's only 50% of the people. Now, I've already said there, I want to repeat it. 60% of the people who are on bedaquiline in the whole world are in South Africa. Recently, the world, I thought you'll cheer up that. I thought you'll do so. I didn't know that you are suffering from jealous down, you know. Yes. Recently, the World Health Organization approved the use of a brand new novel drug called Delaminid. In Japanese, you said this? Delaminid, yes. Delaminido. Okay, yes, it's Delaminid, which is manufactured by Otsuka. As you saw, they presented to us here today. The biggest advantage of this new drug is that it's more efficacious and resistance is very minimal to it. The added advantage of this drug, it is more tolerable, especially among children. You know that we have got problem with children who have got TB, and Delaminid is more tolerable among them. It's also more tolerable among HIV co-infected people, and it's also people who have got diabetes. You'll remember that when I was in the tent, I announced that people who are HIV positive are vulnerable to TB, and people who are diabetic are also vulnerable to TB, and Delaminid is very tolerable to them. And we are very happy because these were the key populations who suffered the TB. The drug received its first regulatory approval from the European Medicine Agency in 2014 for treatment of adult pulmonary MDR-TB. And since then, we understand it has been distributed in 45 countries to, at the moment, over 2,100 patients. We have again repeatedly moved, and recently we have secured approval from Medicine Regulatory Authority. Our Medicine Control Council, MCC, they've agreed, even before registration, to make the drug available. And I'm happy to announce that this drug is going to be available to 400 patients, MDR patients in South Africa in the beginning, only in 4 provinces. Yes, courtesy of Otsuka, we must thank them again. They are giving us that drug free of charge. And according to my calculation, if I'm not wrong, each patient who is treated, it will cost close to 14,000 rand. And that is being given free of charge to us per patient. You can't stop clapping. You can't. Initially, it will be available in Gauteng, KwaZulu-Natal, Northwest, and Western Cape. No favors done. These are the provinces with the biggest prevalence of TB in our country. Gauteng, KwaZulu-Natal, Northwest, and Western Cape. They carry the biggest burden of TB in the country, and that's why we're starting with them. And so this is being done to the 400 patients as part of a research project. It's not yet a roll out. We have not yet rolled it out. But I'm promising, Premier, you know, we did the same thing with bedaquiline. When we rolled it out, we became #1 in the world. And I'm promising you, we started now with Delaminid. When we are ready and we roll it out, I'll announce that we are #1 in the world. I'm going to do so. So today we mark an important milestone through which we'll invigorate South Africa's response to TB epidemic in general, but especially to drug-resistant TB in particular, with the launch of this Delaminid Clinical Access Research Program. This is the program we are launching today. It's called the Clinical Access Research Program. because the drug is going to be accessible to 400 patients preliminarily for research, because this is technical, simply because it's not yet registered in South Africa. And so the access program is a partnership between ourselves, Otsuka, and Right to Care in South Africa. And I will not stop from thanking the government of Japan. I visited your country in 2015 and met with your Minister of Health in an event which was called by your Prime Minister. I pleaded with the minister that they must make Delaminid available to us. I know international negotiations usually take ages, and that today is 2017, it's only 2 years or 18 months, is something that I'm very proud of and very happy. That it was only in 2015, in December, that I was in Tokyo and we speak about this, and it's now March 2017, and we are no longer speaking. It's here, you saw it. I presented to you. That was the fastest negotiation I've ever undertaken, and I'm very happy for that. We will work very hard to make sure that we expand it beyond the 400 people. Notwithstanding the success we are making here today, let me remind all of us that introducing the new drugs, while necessary, will not be sufficient to move South Africa to the important goal of ending TB as a public health threat by 2030. You know, I always pause when I mention this, whether it will be possible that by 2030 we'll have done away with TB. But this is what we have promised. In the Stop TB Partnership, we promised that. In the World Health Organization, Dr. Chadora, we promised that. At the United Nations, when they were adopting the 17 Sustainable Development Goals, we promised that. In our own National Development Plan, we have promised that. We are simply saying, by 2030, we must have done away with TB. We also said the same thing about HIV and AIDS. Now, what it will mean is this. Next week, Premier, we will be launching the National Strategic Plan. We are not only celebrating World TB Day in Free State, we are also taking that opportunity next week to launch the third South African National Strategic Plan for TB, HIV, AIDS, and sexually transmitted infection, STIs. The first one, just to remind you, was launched in 2007 to 2012. The second one was launched in Ibai, Nelson Mandela Bay, in 2012. It was 2012 to 2016. We are now launching the third one, which is 2016 to 2022. Meaning, what are we going to do for the next 5 years? I'm not here to launch it. It's going to be launched by the Deputy President. He's going to read all the things that we are going to do. But I think I'm at liberty to tell you that number one on the things that we'll be mentioning is prevention. We need to work very hard. It is as well good. Yes, you can applaud. Prevention. Yes. I'm still not sure, Premier, why the world is the way it is. It's so difficult now to move healthcare systems around the world towards prevention, because curative healthcare system has won the day. When we tell people about prevention, they believe it's second-rate care, healthcare. They believe you are moving them. They believe you only concentrate on prevention when you are poor. If you are rich, no, you don't need prevention. Just get sick, there will be drugs to fix you. Yes, that's a mentality around the world now, that rich people or rich countries should not even talk about prevention. Is for the poor. You get sick, they inject you and all that. I'm sure you have heard people who were here. People who said, I was on kanamycin and streptomycin for 14 months. Injection for 14 months. What they were not telling you is that they get injected every day for 14 months. Just imagine yourself getting a jab on your buttock every day for 14 months without any single day. Do you inject it once a day, nurses? Once, yes. Every single day when you wake up, you know somebody is going to poke your bum with an injection, and that's going to happen for 14 months. You can imagine. So even if you are rich, it doesn't matter whether you are a billionaire or not, we're going to poke you. So for that reason, the issue of thinking that prevention is for poor people is a very wrong thing. We need to put it ahead of everything else. Prevention and prevention and prevention. Why I say it's funny, Premier, when I went to school for the first time, by the way, I'm very old. I went to school for the first time more than 50 years ago. When I went to school for the first time 52 years ago. That's when I was in sub-A. So that's how long it was, yes. When I was there, they used to teach us, prevention is better than cure. Yes, maybe I must put it in my own language because that's the language in which I learned. Thibela malwetse phala kalafi. They used to say that, yes. Teachers used to make us sing that. Thibela malwetse phala kalafi. We used to sing that in sub-A. But now is many years later, we're struggling to tell people, gore thibela malwetse phala kalafi. Kalafi is important for those who are sick. You can ask them. But for all of us, we need to work very hard to prevent these diseases, especially TB. Because I told you that for every one person who gets TB, they can infect 15 others in their lifetime. So working towards prevention is very important. And maybe before I see it in conclusion, this is what we are doing in South Africa. We have identified the areas where people are very prone to get TB. Number one is correctional services. Those inmates who are in correctional service facilities are more prone to TB than anybody. And there are 160,000 of them. We have got a policy starting from 2013 in all the correctional service facilities, what you call jails, that any inmate who goes in there must get screened for TB. During the time they are in, we screen them 2 times. When they go out, we screen them again and even follow them at home to see if their families can be screened. We have already done more than 500,000 screenings in correctional service facilities. The correctional service facilities in the country have been divided into 7 clusters. Each of the clusters has got a gene expert machine in them to help screen those inmates. The second group of people we are screening are the people working in the mines. They are the second vulnerable after correctional service facilities. There are 500,000 mine workers in the country. They need to be screened very often. TB is killing more people in the mines than even the rock falls. Even the unions don't know that. Even when you tell them, it doesn't evoke the emotions like rock falls. And I'm not saying rock falls are not dangerous, accidents in the mines. But I was telling NUM the other day that in 2009, 80 people who are their members died of mining accidents, of rock falls. And we have heard about it because there was a lot of noise. 80 people, that was 2009. But in the same year, 1,500 died of TB. But it was not even indicated on their radar screen as a union. And I told them that your members are dying of TB more than they are dying of rock falls. So if the unions must make sure that they defend their members, they must defend them against TB, especially in the gold mines, because there's a lot of silica dust. So we have told the mine owners that you are duty bound to screen these people, and no longer at the expense of the state, at your own expense, because they are digging the gold for you. You can't let them dig gold and get rich and get rich from the gold when you are poor. Yes. Around 1980, 80% of the gold of the world was produced in South Africa. Today we are paying the price. Yes, we produced richness from the gold. Today we are paying the price because of what the gold produced for us. So I said to the owners of the gold mines and the other mines, screen these workers, and we are not going to pay at the state. You must pay because this is your gold, it's not ours. And the only thing we have done as the government, we have hired 9 inspectors, which we are paying. The work of these inspectors is to move from each and every mine to make sure that people are being screened for TB. And I'm happy to announce that by last year, our 9 inspectors informed us that 90% of the mines are screening people for TB. I'm very happy about it. Lastly, the people who are staying around the mining dams, we call them peri-mining communities. Premier, in your province, is mostly around Carltonville. Yes, in the West End, you see a lot of dams, yellow dams there. Many people don't think much about them. People are getting a lot of TB from there. And so we are encouraging especially people who are staying close to those mining dams. When you go to the hospital, and Premier, when you go around telling your people, addressing your people around Gauteng, announce this, especially for the western region of your province. When they go to the clinic for anything, for immunization, to collect condoms, to collect contraceptives, for flu, for anything, ask the nurse to screen you for TB. And when we say screening, we don't necessarily mean being given a sputum and giving the sputum and gene extract. We don't mean that. A simple oral screening. You are asked 5 questions. And if you answer yes to them, we'll then go to the next step of using gene extract. I'm not going to tell you those questions because you'll arrive at the clinic and answer yes to all of them. So I'm not going to tell you. It's like an exam. We don't tell you before you go and write. I want you to go. The nurse will ask you the 5 questions and you'll answer truthfully. If I tell you today what they ask, you're going to memorize and say, yes, 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 because you want to see what they do to your sputum. So I don't want that, but I want to emphasize, please ask. It doesn't matter who you are. Those who are diabetic, I've already mentioned. Those who have got celiac, I've already mentioned. Children, people stay in formal settlement, but anybody, because unlike HIV and AIDS, TB is propagated through the air. So you can get it anytime. Any one of you can get TB anytime. That's why Dr. Victoria Matisela told you here, he got TB while he was a medical student. They treated him. He went to get it again while he was a doctor. They treated him. You are our icon, Nelson Mandela, got it. Our other icon, Bishop Desmond Tutu, got it. I'm happy today that I've got many ambassadors here, those people who raise their hands. But among our ambassadors, as you know already, ambassadors for TB, amongst them we have got very prominent people. One of them is the son of King Zwelitin. And I'm quoting him amongst them because he stood up in a conference. He said TB can infect anybody. It came to the royal place and found guards at the gate, passed them, and went inside and got the prince. That's what he told us. He said there were lots of guards at the gate there. But TB came marching, past those guards, went inside, found the king and the prince and the queen, grabbed the prince and sat inside him. He had to go to hospital. That's what TB can do. So we must spread that message that anybody can get TB and let's fight it. Thank you very much. Unfortunately, I'm not going to. Yeah, Dr. Chadora, my spokesperson asked me to say something. For those gentlemen there with cameras, they can spread the very good messages, but sometimes they can spread very wrong messages, like they did last week. I was reading News 24, There was an article where they were praising one young lady for bringing private clinics to the townships, starting with Diepsloot. And as I was reading the article, they said the World Health Organization has declared South Africa to be one of the worst healthcare systems in the world. I was shocked. I said, how? Where does this come from? They said, we are the worst. I phoned News 24 and say, can you show me where you got this from? Because I know nothing about it. That we are the worst, and we've been declared so by the World Health Organization. Fortunately, News 24 were very magnanimous. They removed it from their website immediately. But then they sent me a link. They said, no, Minister, this article is not originally from us. It's from Bloomberg. Now, Bloomberg is an international publication. It's American and it's respected. And they sent me the article I read there, the subheadings. WHO declares South Africa one of the worst healthcare systems in the world. I was shocked. So we phoned Geneva and Dr. Chadora, the World Health Organization. Can you give us this ranking that we've been ranked one of the worst in the world? I don't know about it. And now Dr. Chadora has just explained. That ranking was done in 2000, and all the countries rejected it because the methodology was wrong. And the World Organization withdrew it. It's nullified. But the reason that at that time in 2000 we were ranked the worst was not because we ran the worst health system. One of the criteria they were using was equity. And as you know, South Africa is the most inequitable country in the world. And so when you score countries according to equity, South Africa will score last. Not because we are running the worst healthcare system. I'm mentioning that because these nurses who are working very hard will get discouraged. When you tell them they are running the worst system, despite what you heard from patients here, they told you, Dr. Ramatisela told you, he named 5 hospitals which are supposed to be the best in the country by virtue of being private. They could not help him for TB. He went to Charlotte Macleod, he got it. They helped him. All the patients who spoke this morning, they went all over, they could not be helped. They came to Sizwe, they were helped. They say the nurses are their family. They are part of their family. The psychologists, the social workers. And yet, last week we were told we are the worst in the world. So I just want you people in the media, when you make these statements, know how heavily they weigh to people who work day and night. Check them left and right. If they are true, I won't complain. Honestly, I won't complain. But I followed the Bloomberg article as a Minister of Health because I was shocked and I knew there was nothing like that. Now you can imagine an American publication which is so respected, writing so wrongly about something that was 17 years ago. But that also has been nullified because of wrong methodology. They put it in 17 years later as the golden truth. So I just want people to be very careful because health workers are working day and night to help you people in the population. And you must appreciate them. And nurses, I want you to be appreciated today. I'm very proud of you, very, very proud of you. And the Premier is going to remain with you. Some of the problems you are experiencing, you will tell them to the Premier. We'll try to sit together and solve them for you. Thank you very much.
Yeah, I think as we release the Minister, I would just like to remind him that indeed the burden of disease in our country has been uppermost in the governing party. And that is why in 2012 conference, there was a resolution of establishing a National Health Promotion Council. And we look forward to that council, which would be a multidisciplinary partnership to reduce the burden of disease. Premier, I know I have not as yet briefed you on this, so I have witnesses now, but it is my intention to establish an award, recognition award of the health promoting municipalities. to assess each municipality in our province as to the extent to which they are going to promote health and prevent diseases and reduce disease burden. Obviously, we will work with them, so our various health workers and health leaders will work with them, but also take it even further down to look at health promoting wards where we live as such. So the fight against disease is a fight we can win, and 2030 to improve life expectancy of South Africans to 70 must mean that we have also defeated TB. So it is possible. Let's give the Minister once more a round of applause as an acknowledgement of his activism, passion, and dedication in keeping us healthy and living longer. I'm going to ask that we call the Executive Operations Officer of Otsuka Pharmaceutical Company, Mr. Masuhiro Yoshitaki, please.
Honorable Minister Motsoaledi, Honorable Ambassador Hiroki, and Honorable Premier, Honorable MEC, and doctor and nurse and public health officers, and most importantly, to the patient and other members of the TB affected community. I'd like to thank you on behalf of Otsuka Pharmaceutical for the opportunity to join you here on the World TB Day. Otsuka Pharmaceutical is one of the leading healthcare companies with approximately 31,000 employees located all over the world. TB was one of the very first research priorities established by our late chairman, Mr. Akihiko Otsuka. Since then, the company has been working tirelessly to deliver innovative solutions in the line with our philosophy of addressing unmet medical needs. Otsuka well recognizes the significance of this day, the importance of events like this one taking place all across the world. They have the power to galvanize support and raise awareness of the challenge we have faced so far too long. For TB, a disease as old as mankind, it's shocking that first drug resistance survey for TB did not start until 1955. And little did we know that the rise of the multi-drug resistance TB, MDR-TB in mid-90s was only beginning of what would become truly global pandemic. Many patients have suffered from MDR-TB due to the lack of the attention given to disease that many in the research community and private sector had turned it back on. But no longer. Today we were celebrating hope. Today we are celebrating a new chance to fight back against TB with new tools, new innovation, and new partnership. During the last 30 years, Otsuka Pharmaceutical have been committed to TB-related research and development. After a long process of screening an anti-TB compound, in 2004, we are finally ready to begin clinical trial of Delaminid, which became one of the first new treatments for drug-resistant TB in over the last half century. It was beginning for a long journey and continues today. Right here at Sizwe Hospital, we are extremely proud to officially launch the Delaminid Clinical Access Program, so-called DCAP. Today's launch is a cumulus of many months of hard work and collaboration between all parties involved. I'd like especially thank you to the Department of Health and the National TB Program, and also Dr. Norbert Enjeka, and Right to Care, and all implementation partners, including the principal investigator and treating physician and experts on a new drug and new regimen clinical advisory committee. Thank you for your hard work. This innovative program will help contribute to ever-expanding evidence base for use of new medicine in treating of MDR-TB. I'm also very grateful and thank you for very genius support of Ambassador Hiroki and the Embassy of Japan in South Africa. Embassy was instrumental in convening key stakeholders and elevating tuberculosis as a critical public health issue that was full attention of the government of Japan. While today we celebrating beginning of this program, for Otsuka, it is one of the many important steps toward building long and fruitful collaboration fighting TB in South Africa. Our involvement began with TB clinical research at the 3 different locations in South Africa, including research focused on especially on HIV-affected individuals as well as children. And we are partner in several research projects led by other organizations are planned to or ready to taking place in this South Africa. DCAP represents next step of the taking important research innovative and initiative. Implementation them on a broader and programmatic level. We want to know we are remain heavily involved in rollout of this DCAP and committed to be your partner every step of the way. In parallel with the rollout of DCAP, Otsuka will also closely working with a local partner who will make a registration to medicinal control council to ensure our product Delaminid can be available many people throughout this country in the very near future. There is still a lot of the work to be done, but we are encouraged by great progress we have made so far together with you. Otsuka remain committed, continuing fighting against TB with additional research in new compounds, pediatric formulation, biomarker, and treatment monitoring tool, and other exciting projects. Especially, Otsuka has also started second new anti-TB drug clinical study, right now phase 1 trial in the United States. Also, we are developing the biomarker as a tool to speed up drug development. South Africa will remain in the pivotal and vital partner in this work also. Otsuka is invested in TB and in South Africa for a long time. We will continue to stand side by side with National TB Program and other organizations to ensure that South Africa will have the best tool available to them so that they can live long, healthy, and productive lives. So once again, I'd like to thank you for your support in this mission, and I'm very looking forward to make more exciting milestones together in the near future. Thank you very much.
That's a special appreciation through music. But let's give our private sector partner, Otsuka, a round of applause for that partnership. Thank you very much. I'm going to ask Dr. Nazir Ismail now to launch the online TB surveillance dashboard. Dr. Ismail is the head of the Center of TB of the National Institute of Communicable Diseases, one of the centers of excellence that is actually assisting even the continent in containing disease and managing infectious diseases. Dr. Ismail, thank you.
Come again?
This one is yours.
Yeah. Right. Good morning to everyone. Thank you for this opportunity, specifically to the Minister of Health and the Director General of South Africa. Also, acknowledgements to the Premier of Gauteng, the MEC of Health, the Ambassador from Japan, the WHO Country Director, and obviously the SENEC Deputy Chair. We thank you for this opportunity as well to share something very important for the country and links to what the Minister had spoken about earlier on. South Africa is focused on ending TB. And we really hope to achieve that within our lifetime. And the targets are set for 2035. In order to ensure that we can direct our efforts appropriately, the National Institute for Communicable Diseases, working with the Department of Health, have developed a dashboard to track and monitor our successes and failures and guide our responses. I do believe we can end TB by 2035, but it'll really require all hands on board. What I'll present today is the launch of an online dashboard that provides a powerful analysis of the TB epidemic in South Africa over time and also geographically. You would have received a handout. I'm not going to go through the handout. It basically highlights the key issues that have been identified analyzing data from 2004 for South Africa. However, I'm going to show you the use of the dashboard. It's available through the NICD website. If you go to the www.nicd.co.za, the National Institute for Communicable Diseases, and if you just scroll at the bottom of the page, you'll find hyperlinks to the dashboard. And at the bottom there you see National TB Surveillance Dashboard. And if I click on it, it brings you to a login screen to view the dashboard. This is really exciting stuff in terms of being able to understand. There's a famous saying from WHO, know your epidemic, know your response. And fundamentally, this provides us the tool as government and as civil society to be able to direct our efforts more effectively. For today's demonstration, you can just click on guest user, and it'll take you to a landing page that says, gives you a variety of options. If you click on online dashboards, you'll see there's a variety of options available. Unfortunately, the screen is not very clear today, but there's options for HIV and for TB and for antimicrobial resistance. And today we're launching officially this TB surveillance dashboard. And if you click on TB, it loads a live dashboard that provides a drillable, clickable, and analyzable tool for understanding the TB epidemic. And there we have it. So that's the landing page of the dashboard. It provides you a map of South Africa. And the bubbles that you see there is very much what the Minister has spoken about earlier on. It gives you a sense of the size of the absolute burden of TB in South Africa. The blue bubbles on that map indicate that. And if you look at where Gauteng is, it's a large bubble. It carries a large burden of TB nationally. And the other main provinces are KwaZulu-Natal, which has the highest burden, Eastern Cape and Western Cape. So this provides a visual presentation of the current burden of TB across the country. The population pyramid in the middle, the lighter color is number of TB cases among females, and the darker color is among males. And you'll notice the stark difference between the two. The pyramids for female are generally younger. We know that TB affects, at least for HIV, but also for TB, younger females. But specifically for men, it's older men, where we have a higher burden of TB disease. And that's an important part. If you look at over 35 years of age, where the middle of that pyramid shows, there's twice as many males as females that have TB above the age of 35. It's an important population group. We need to think and change our paradigm in terms of TB versus HIV. Often with HIV, the emphasis is a lot on young females, and the successes have been seen there. And we do see that with TB, and I'll highlight that just now. But the other challenges are related to men, and how do we deal with that population group. On the extreme right, you see a line graph that runs across. And you'll notice that it's slowly declining. And that's basically an evidence to say that in South Africa, we have observed a decline in TB incidence. That's after adjusting for the population that we have in South Africa. TB does show a positive evidence of decline year on year. But you'll know that the NTB strategy requires a 10% year-on-year decline, and we're quite far off from achieving that, but we are on the right track. So we are going in the right direction, and we're quite happy with that. What I'm going to move on to is to look at I'll just show you around the dashboard to highlight what are the key elements that you can identify through the dashboard. So what we'll just do is, sorry about that. We can just click on the arrow there, and the map provides the number of actual cases of TB, whereas when we look at incidence, which is what WHO is focusing on, incidence adjusts for your population size. South Africa has 55 million people. You know, if you look at China, over 1 billion people, so you can't compare apples and apples. And therefore, when you look at incidence, it adjusts for population size. And on the dashboard, if you just click on the arrow on the side there, it gives you options, and you can look at rate per 100,000 population, and you'll notice the bubbles change. And if we just look at that more carefully, you'll notice that for Eastern Cape, there seems to be despite its large population size, it has a very high incidence of TB. And that speaks not only to burden in terms of operational needs, but more specifically about transmission. And as the Minister said, every case that we miss, there's 15 others that get infected. And the key ideas around prevention and early detection and treatment are core to our efforts to control tuberculosis. So going forward with that, we can even drill down. We can look at different years. So currently on that drop-down menu, the one that's displayed is 2015. But in this case here, I'll just select 2011, and we can just compare. What I want you to notice is look at the Eastern Cape bubble. And if I look at 2011, it has stayed relatively the same. And that raises some challenges for us of how do we deal with incidents in those settings as such. What's very fascinating about the pyramid, okay, the thing's still loading, but you'll notice that among females, the pyramid looks very different. And this is in 2011, there were a lot more females, the pyramid are higher among the lighter color. But in 2015, we actually see a decline. And that's something I'd like to show you more clearly now. So we'll just enlarge the screen, so I just want to go to the zoom a bit and make it a bit bigger. All right, so it's loading. All right, so it's slightly bigger. And what we're going to go down to now is to look at by province. And this describes the incidence trends for all the different provinces in South Africa. It almost looks like a hamburger. And that's really South Africa. It's a mix of different populations across the country. We find that Eastern Cape has the highest incidence, whereas Limpopo has the lowest. But a lot of provinces fit somewhere in between this. But to make it more clear and to understand where we are in terms of ending TB, let's just remove the provinces quickly. All right, so you can just remove the graph. So it's a clickable dashboard, a live dashboard. And let me just click on KwaZulu-Natal. So this is what we're supposed to be seeing in terms of ending TB. So this displays from 2011 to 2015, and the decline in TB incidence in KwaZulu-Natal. A very positive finding, and actually maps to the annual decline expected by the NTB strategy, a 10% year-on-year decline. And that has been a very positive sign with KwaZulu-Natal, the country with the highest burden in South Africa. I'm going to click on Western Cape, and you'll notice something interesting about this curve, is that Western Cape had a very similar decline early on, and has almost flatlined in the more recent years. And I'll speak to what we think the reasons are for that. But it's important that when we look at the analysis we've done previously, the sharp decline we've seen very early on has been the ART program impacting on TB. We know that we've had, the Minister has done a fantastic job in terms of controlling HIV, rolling out ARTs, and the benefit is not just for the HIV program, it benefits the TB program as well. And we've seen significant benefits to that as such. When you look at Gauteng, where we are right now, there's been a consistent slow decline. And year on year, we've seen successes with the program. Both Gauteng and Western Cape were the ones that were the early adopters of the ART program, and they've actually seen the benefits over time. We can just go back to all the provinces, and now we can move up to the provincial view. So for people that are in a specific province, you can click on the province. And in this case here, we've got Eastern Cape that comes up. And I'll just change it to Free State. And this allows us to look at TB in terms of not just provinces, but districts as well. And this is one of the most important highlights I'd like to come to, and that is the power of the dashboard. This shows you Free State and the different bubbles. And if you click on, we know Mangaung is a high priority district, but if you click on the bubble that's just slightly higher, you can identify areas where we see high burdens of TB. The last thing I'd like to move on to, and we can just enlarge the screen for that, is to specifically look at the age and gender, and I'll end off with this one here. What's most fascinating and what you see here, okay, it's very unclear on this graph, unfortunately, but you'll see it in the pack that you've had there. If you look at the handout that you've received, I've labeled it as ladies first, men follow. And if you look at the graph in your handout, you'll see that there's an extremely sharp decline. Well, you can't see it, I know you can't see it, but there's a very sharp decline among females. And I'll make it a bit more clearer, so that's a bit better. So that's basically among females between the age of 25 and 44. And if I add in the other age groups, now it looks a bit better. If you look at the blue line and the females on the right, you see a very sharp decline. And for us, the understanding there is that the HIV program has placed great emphasis on women 25 to 44, and we see the benefits. We see a major decline in TB incidence among females. But if you look on the other hand, if you look at among males, they're kind of stubborn. They're not shifting. And I think that's our challenge as well, is that among men, we really need to change the health-seeking behavior among men. And as I highlighted earlier, the older men are the ones that have the higher burden of TB. They're the ones that transmit as well to their families. And that's an important target group. So I'm going to fly through the rest. Let me just click through. We can just get to the last one. There's a map view as well where you can look at any district or sub-district in the country. I'll just zoom it in a bit for you. What you'll notice is, for example, there's something happening around Pumalanga area there on the side. And we could just drag it across and we can just enlarge it a bit and figure out what's going on. There seems to be a higher incidence in that area. And that's the district, and there, 975 incident microbiologically confirmed cases, twice the national average. So the tool that we provide and we launched today really provides the country with the right evidence and information to guide our responses, both as government and as civil society, and we hope that people will use the tool. As I mentioned, you can go to the NICD website, and you can click on it, and you can find the information. And I know today's event has been about drug-resistant TB. We completed a survey 2 years ago, and we've got a beautiful clip on the life story of Tebogo. If you click on the NICD landing page, there's a YouTube video of a life story about drug-resistant TB. And she ends up with a very powerful message. She's beaten TB, and we can all do the same. So it's all for us to strengthen our efforts together. Thank you.
If you can't count it, you can't achieve it. So monitoring is important. The baselines in Gauteng Premier, we look forward to giving the baselines also in every ward. It may be a journey, and that is why we need technology. So we'll build on the tool that has just been launched by the National Institute of Communicable Diseases or Infectious Diseases. Let's give Dr. Ishmael another round of applause. I'm going to ask Ms. Steve Litsike, the South African National AIDS Council, also responsible for a partnership, national partnership against TB and STIs, who's the deputy chair to our deputy president, and also the chair of civil society, to come and share with us her ideas and her advice and a commitment of civil society towards fighting successfully TB in our country and in our continent. Thank you. Ms. Litsike.
Thank you so much, Program Director and the Honorable MEC of Health in Gauteng, Honorable Premier of Gauteng, Mr. David Makuru. In his absence, Dr. Aaron Motsoaledi, the Minister of Health, the Ambassador Hiroki from Japan, Mr. Yoshitake from Otsuka Pharmaceutical Company, WHO representative Dr. Chadora, representative from the Provincial AIDS Councils. First, we do have the co-chair of Gauteng Provincial AIDS Council, Reverend Moerane, and in our midst, we also have the Provincial AIDS Council co-chairs from KwaZulu-Natal, Mr. Patrick Ndleje. We've got a representative again from Mpumalanga, Provincial AIDS Council, Bishop Mtembu, and we've got also the national sector leaders amongst ourselves from National Civil Society Forum, colleagues from the Department of Health, colleagues from other sectors and civil society and private sector, the ambassadors of TB campaign, the health workers from various institutions, but also from Sizwe Hospital. Let me send my regards to everyone here. It is unfortunate that the Deputy President could not join us today, but he does send his warmest regards, particularly from the department, from Presidency, but also from the South African National AIDS Council. The MEC was correct. We did speak earlier about how the terrains have shifted and how we need to consider the integration so that we give proper attention to many diseases that affect our population. And I do think we will take that conversation forward, MEC, in terms of recognizing the other diseases as we fight the epidemics. And it's also very important that we recognize that the HIV movement benefited from the movement that existed from the AIDS activists, the HIV activists, and TB will benefit if we have such magnitude of a movement. South African National AIDS Council, it's a multi-sectoral council. It sits civil society, it sits government, it sits private sector together, which we're saying that it cannot be done by one specific sector. And we've seen great achievements, of course. First, to recognize the political will from the highest office within the presidency, which we have a chairperson, deputy president leading the HIV, TB, and STI response in South Africa. And we have also seen the premiers in the provinces. We are also seeing the executive mayors from the cities, from the metros, and the councillors. And it's unfortunate, earlier I wanted to mention the patient that is admitted here in Sizwe Hospital, who's a councillor from Merafing, that from here he needs to go back and lead the AIDS Council in his municipality, in his ward. It is indeed that the experience teaches us, and we are, at the end of the day, going to be humble because of the affected population that we are part of. Honorable Premier, the MEC and guests, I want to share just a few issues or things that we have recognized as the National AIDS Council. We need to recognize that South Africa still ranks number 6 in the world, and which then says we are part of the 22 countries across the world that carries the high burden of TB. Now, this is the disease that is older than many of us sitting here, and I speak as a young person. I'm sure those who are older will still not qualify to say that this disease is much older than them as well. But it's a disease that can be treated, that can be cured. We really need to get this right. In 2015, South Africa estimated that we have over 450,000 new TB cases. Now, this is unacceptable. In 2014, 834 cases per 100,000 population. However, we've also seen the modest decline in these numbers, and I think we really need to applaud the effort of our government to ensuring that people can access treatment, and also to applaud the effort of many other stakeholders that are involved to ensure that there's prevention. That is why we see this decline. But this decline is again short of what in the National Strategic Plan 2012-2016 goal, that we need to see a decline by 50%. We don't want to see the decline by 10% or 30%. And it's very important that we ensure that the decline happens amongst the new TB cases, but also the relapse cases. There's huge links that we need to take in consideration when we speak about TB. The links of TB and HIV. People living with HIV accounts for 63% of incidents that we see in TB. The TB transmitted as well that we see somehow is also not related to HIV. So this is what the Honorable MEC was indicating, that not everyone who has TB has HIV. So if we have to work hard, we also have to work hard outside the scope of HIV. So the very same attention that we gave to TB to HIV must be given to TB. There are quite a number of issues that we need to take in consideration. And I was listening to the patient earlier, Tsholofelo, who was the second patient in South Africa to receive what do we call the treatment? It's this medical terms. I'm gonna get it right. Delaminid treatment. Delaminid. The Tsholofelo indicated earlier that he had stopped his treatment because of challenges at home. He was looking for work, and in looking for work, he misses his treatment, and that is the reason why he relapsed. So, which then means, Honorable Premier, there are a number of things that we need to address which are intersecting. Issues around poverty must be addressed. The medical conditions such as tobacco use. So those who smoke must consider changing that habit. So we're encouraging yourself. We're not saying, we can say stop, but we're encouraging those who use tobacco to stop that habit. The issues around diabetes must be addressed. The issues around silicosis must be addressed. The poor nutrition status of our communities must be addressed. And really the suboptimal living condition of our communities must be addressed. We've spoken about the issues of overcrowding, one in prisons, but again in the early development centers. So we really need to address those issues. Patients present to health facilities late. which then means that we have to decentralize the prevention and the treatment response and go to communities. So we are encouraged by yourself, Honorable Premier, in terms of Ntirisano approach, which says, let's go to where communities are. Let's go to where people are. And we need to take the same approach in terms of addressing TB. Honorable Premier, we've also seen the multi-drug resistant patients doubling. A lot of people are relapsing. We have to retreat. The Honorable Minister was talking of the costs involved. If you usually treat a patient at 400 rand, somebody who's relapsing and who has a multi-drug resistant, we have to now cough out over 400,000 per patient. And it's a lot of money. So which then says that we really need to look at ways where gene expect mission is again going into communities. Decentralizing services remains key. MEC, screening is late. We must confront TB in a testing approach. We need to offer testing more than screening. Where patients report late, it's because they are screened and some of the diagnosis might be late. So I'm really encouraging leaders that we consider the testing approach more than the screening approach. That will help us combat the TB disease. I want to say, within the National Strategic Plan, we have identified the key populations of TB. And Minister of Health have spoken about them. One, people living with HIV are the key population for TB. The household contacts of TB index patients. And earlier, an ambassador mentioned that she got affected because her sister was infected. The healthcare workers are also key populations. So while the healthcare workers are responding and helping out patients, they are mostly vulnerable as well. And we must confront the issues and challenges that are faced by healthcare workers. The inmates, pregnant women, children below the age of 5 years, diabetic patients, people living in informal settlement, mine workers, and peri-mining communities. These are key populations that we have highlighted within the National Strategic Plan. And not to forget the most important population again, it's the people with disability as well. We've had most of the patients that have indicated that also taking the treatment for so long does create disability. Now, in closing, I want to say that MEC, there are key game changers that the country needs to think of. We need to integrate the services and the interventions. Let's not only keep TB on as an isolated matter. It speaks to non-communicable diseases, speaks to many other diseases. We need to build a strong social system in an ecological way, patient-centered, but think about the relationships, think about the communities, but society at large. We need to think of sufficient and training for our health workers. We need to think of awareness, the social behavior campaigns that needs to be reached. And most importantly, to say that the health system strengthening needs to be linked to the community system strengthening. Honorable Premier, for Gauteng to achieve a growth in economy will require a healthy population. Thank you.
Thank you very much. Another round of applause, kindly, please. Ms. Litsika, you did refer to socioeconomic determinants of disease, and also that the health sector contribution to the economy is very key. Actually, there are some studies that say a healthy population contributes to an increased economic growth, and that has been empirically proved. And I think increase in 1 year life expectancy translates to about 4% GDP growth. I think there's a figure that I've come across that indicates so. And we must also learn from countries like Japan that have long life expectancy. And I will certainly, if Premier allowed, would like to help ask the Minister to facilitate that we not only discuss how you can help us with Delaminid, but also with going towards, faster towards having a high life expectancy with Japan, learning from how Japan did it. Thank you very much. At this point in time, Premier, just before you give us your words of wisdom, I'm going to ask Dr. Chatora to greet us. He will be speaking on behalf of WHO at the National Official World TB Day on the 31st of March, but today he'll just greet us.
Thank you, Dr. Gwen Ramakopa. Honorable Premier, Mr. David Makura, the Ambassador of Japan, Your Excellency, Mr. Hiroki, Steve Letsike, my colleague, who is the chair of civil society, chairs of the AIDS, provincial AIDS councils, health workers, and the media. I want to thank you most sincerely, Premier, for inviting us to participate at this function where you are celebrating World TB Day. World TB Day is recognized globally. It's an important day. And as you have heard from the Minister, it is our wish as the global community to do away with TB by the year 2030. I was also pleased to witness the launch of the Delaminid program in South Africa. You must be one of the first countries in the world to be using this drug in the treatment of TB. To me, that demonstrates the commitment of the government of this country to help address the challenges of TB, and to talk about this on another occasion. As you know, I represent World Health Organization, which is a specialized UN agency which is responsible for promoting health, preventing disease, and of course, saving lives. The emphasis is on the preventing disease and the promoting health, which is consistent with what the Minister was saying earlier in the day. We are here in South Africa to work with the government, first and foremost, primarily the Department of Health, but also all other departments that are working on health issues. And in South Africa, you are, I think, far ahead of the other countries, in the sense that beyond the Department of Health, even Treasury, Commerce are engaged in working on health. For example, the work that was happening on the sugar-sweetened beverages. We will also be working with civil society and the many institutions in this country that work on health. We will be working with all the spheres of government. I was saying to the Premier, with time, I'll find time come and visit your offices and talk about health, including with the Make for Health. I'm aware that HIV and TB are the biggest public health problem in this country. I'm also aware of the road you have traveled. I'm also aware of the major achievements you have realized. I'm not saying this to please you, but it is fact. You run the biggest HIV program in the world. Some of the things that happen on HIV in the world are spearheaded from here. So that is commendable. But a lot more still needs to be done. And the starting point, as always, should be prevention. We were associated with the development of the National Strategic Plan that the Minister talked about, that Steve was talking about. And we are aware of the work that you have committed to undertake over the next 5 years. I want to say to you here and now that we will work together with you, support you where we can, but also learn from you and make the rest of the world aware of some of the great work that you will be undertaking. My last message is to the media to say that in the world of today, given what happens, because health is manufactured in the homes, in the workplaces, and in the schools, etc., we rely on the media to share the information, and that those who have the information, including ourselves, are available, should be available to provide you that information so that everyone in the country knows, so that they can contribute to promoting health, preventing diseases, and saving lives in the country. I thank you for the opportunity, and I look forward to working with you over the next couple of years. I thank you.
I think the last speakers are very privileged because their speeches are serenaded by music. But let's give WHO representative another round of applause. Thank you very much. Honorable Premier David Makura, Premier of Gauteng, I know that you chair and put as important the work that is done by the Premier's AIDS Council, which is also responsible for TB. And I'm also aware that you had to put a lot of other responsibilities aside to spend this day with us. And we're asking you to address us, but we really appreciate your leadership. Please do address us, sir. Thank you.
Thank you very much, MEC for Health in our province, Dr. Gwen Ramokgopa, for shepherding us up to this point. I do want to acknowledge in his absence, Dr. Aaron Motsoaledi, the Minister of Health in our country, who we know is working very, very hard to get our health system to meet the needs of our citizens across the land and the length and breadth of our country. The country director of the WHO, Dr. Chitora, who's just spoken before me, the deputy chairperson of SANEC and the leader of the civil society in this front, Comrade Steve. Thank you very much for a very illuminate words about how we must approach dealing with this pandemic. The Japanese ambassador, Ambassador Hiroki, who also gave a message here, and Mr. Yoshitaki, from Otsuka Pharmaceutical Company. We appreciate the contribution of the Japanese to help us fight the scourge of TB, as we are doing right now, and the co-chairpersons of AIDS councils in Mpumalanga, KZN, and in our province, who are here, and members of the AIDS councils, SANEC, and the provinces. I've seen a number of members of our AIDS council who are also here, and the civil society representatives who have joined us. I particularly want to acknowledge the CEO of Sizwe and the staff who are here. We are going to have a meeting right now, so I need to finish quickly so that we can have our meeting. Mine is basically, very briefly, to first thank all of you for turning up here on World TB Day, so that we can send a very strong message out there that we are determined to end TB. We are determined to win the war against TB. We know TB, as the minister said earlier on, is now the biggest killer, 1.5 million people per annum all over the world, and especially in developing countries, perish out of TB. We know that together with HIV and AIDS, they have the greatest impact in the developing countries, especially where there is a multiplicity of factors and conditions under which people live, which affect them. And Steve was articulating that when he spoke about the need to have a multi-pronged approach, multidisciplinary approach, and a multi-stakeholder and multi-sectoral approach. But we have to first start with our health workers. Our healthcare system is overburdened with disease. That's the big part of our story, is that our healthcare system is overburdened with disease. Unlike in countries like Japan and Cuba, where there's much stronger preventive measures and a much stronger primary healthcare system, ours is overburdened with disease. So, which means that our healthcare institutions and facilities and healthcare workers are overworked, generally. They work much longer hours, they are overworked. So we have a large number of our population in and out of health facilities, and therefore away from some productive work, away from work that earns income, away from other social activities that contribute to the well-being of our communities. So this is a very important context as we fight TB and as we fight HIV and AIDS. We must do so in a way that strengthens the entire healthcare system. So the foundations of our healthcare system must be very, very strong. And we must do so by starting with primary healthcare, particularly where most of our people are located. We need very, very strong primary healthcare institutions. We need to deploy some of our best doctors and health professionals right there and turn this pyramid upside down. Instead of our healthcare, the best healthcare workers and professionals and specialists being concentrated in the tertiary institutions, we will have to deploy them. And that's a commitment that we are very keen. MEC Ramukhopa it's very, very keen to help us do this. I have had discussions with the civil society in our province that we need to go deep into looking at what is it that's not working in our healthcare system, and how do we improve where the failures of our healthcare system are, and what is it that's working well, such as Sizwe, and how do we ensure that there are more centers of excellence, more positive experiences by patients and families across our healthcare system. And that's, I want to repeat what I said earlier on, that what you are doing at Sizwe, Dr. Low, what you are doing at Sizwe, we're following that every day. Now you need to know that whatever you do here is on the radar screen of the Premier and the MEC, because as a center of excellence, we want you to teach others how do you run a healthcare facility that delivers and meets the expectations of our patients and their families. We need to know that the experiences in the healthcare system is not only by those who are sick, but it's by families. When a family member comes to see, they are very observant. The first thing they look at, even before they get feedback, they experience right from the gate, right up to the ward. They experience how this institution is. From the security guard to the cleaner, right to the nurse and to the doctor. So it's a very holistic and integrated experience. So that's why we have given you that award. We have given you that award as an acknowledgement of your contribution. But we also want you to teach others. You might be dealing here with treatment of particularly multi-drug resistance, MDR and HDR, because we know that there are other facilities that are treating TB, but you must know that you are dealing with health in any case. So if we can have a hospital that's run well, it means we can have a healthcare system that functions well, right up to a clinic in Tateong or a CHC in Kagiso or a hospital in Sebokeng. We need that same level of quality. If you are not about caring for people, don't be in the healthcare system. If you are impatient with people, you can't tolerate the sick, don't be in the health services. Because there it's about caring and helping those who most of the time can't do things for themselves. Some of the sick can't even, the nurses will tell you, they can't bath themselves. So, we want those who have patience, we want those who really care. And here, the workers, the nurses, the doctors at Sizwe, you are very exemplary for us. We want you We want to tell the story of Sizwe everywhere. I saw in the survey that we got from the Gauteng City Region Observatory, we got that survey in July last year. The report in that survey said most patients and families' complaints about healthcare are about the treatment by those who work in the healthcare system. They said the treatment is bad. There's no batupili. That's what the survey said. The biggest complaint by patients about healthcare facilities is about treatment. And we want to say we will solve this problem of how health workers treat patients because Sizwe has solved this problem. And we got the news from those who came to Sizwe. It's not from a survey, it's not from our heads. It's from those. So we want every health facility in Gauteng province to prioritize improving patient care, reducing on waiting time. And there's this place called Casualty, modernizing our health facilities so that people don't have to be told we have lost your file. And the elderly don't have to come at 5 o'clock waiting because they have to spend 2 hours before opening. We have to solve that problem. And we solve that problem by modernizing our services, but improving the quality of care. A nurse is a nurse. You know, we know the old nurses, how they were trained. Old nurses were trained about care. We know, and that's why I wrote the story of the nurses of Sizwe. That's why I'm going to meet with you. If the story was very bad, I was not going to meet with you. If the patients had said, oh, these people are treating us, they beat us up. You know, there are facilities and hospitals where nurses beat up patients. Yeah, the patients tell us when we go there. The nurses beat us up. They starve us. They don't treat us well. But here you do what nurses are trained for. The doctors attend to us. That is the story we want. The story of, we run a massive healthcare system. In the context of South Africa, Gauteng runs a massive healthcare system. There are 7.1 million people who visit healthcare facilities in Gauteng per annum. So every year, the Gauteng healthcare workers see 7.1 million people. Some of them come from across the SADC region. And one of the challenges with TB is that the problem of lack of follow-up is because we have a huge migration problem. I'm sure the nurses and the doctors know this. So there will be people who come into Gauteng, they come to Sizwe, they get treated. When they are supposed to do follow-ups, they are no longer here. They are in the Eastern Cape or they are in Limpopo. Or they are in Northern Cape. So that does also impact migration, which is a big issue, big problem for everything we do in Gauteng. High rate of migration impacts on what we do. But we have no excuse. We want to improve, we want to see results on cure rate. For MDR and SDR patients, we want to see real improvements. And Sizwe, you have our full support. So whatever challenges you face, you have our full support. I want to say to our civil society partners, we can't succeed without you. There is no way government is going to succeed without civil society. The story of our success in dealing with HIV and AIDS is the story of mobilization, social mobilization. The story of mobilizing everyone and taking action everywhere to speak up and ensure that we deal with the problem. So if there's something we must learn from that campaign, is that to end TB, we need the lessons of the fight against HIV and AIDS. So stigma, the patients who spoke about stigma earlier on, we know that the stigma on HIV and AIDS was 1,000,000 times bigger than the stigma on TB. But working together in the campaign, destigmatizing this, we now know that even though stigma is still a problem, but we have significantly changed the attitudes. Every family, I know every one of us grew up in a family where there was someone who had TB. And for many years, Steve, you were talking about the question of how old TB is. But for many years, even if we grew up in families where there was always someone with TB, the stigma is still there. The stigma is stubborn, which also means we must mobilize, work together in the same way that we worked. And I like the multidisciplinary multi-sectoral integrated approach. If we can identify 3 areas of healthcare or 4, around which we already have 2, that's HIV and AIDS, TB, around which we need this concerted social action by government, bring in business, bring international partners, we will get very, very far. And I want to conclude by giving an example of the work we are doing. In the new year, we're going to be working together with our social partners to HIV and AIDS to the girl child in schools. The girls, the young women and girl children we know on HIV and AIDS, the biggest threat now is coming in that direction. So we are going to be working together through our AIDS Council with civil society and all stakeholders. We have to reach 2.1 million young people in the Gauteng schools by the end of this financial year, which means by end of March next year. Through all our efforts, concerted efforts, we must reach 2.1 million young people in our schools, especially the young women across the system. If we don't intervene there, we're facing a real reversal on HIV and AIDS. With TB, we must do the same. And the National Strategic Plan will help us a lot, which with our meeting next month of the Gauteng AIDS Council, we'll also look at the specific dimensions of that. So the focus on HIV and AIDS, on TB and on STIs is a very important, but we need to say in each of these, who are the most vulnerable groups and which are the most vulnerable regions in Gauteng. So if TB, the most vulnerable people would be in the West Rand, we will have to have a concerted campaign that also target geographically those communities. And sectors of communities that are more affected, if it's males, with regard to TB of particular ages, that's the best way we must carry this campaign. So I want to thank all of you and again emphasize, but we need a strong healthcare system at the back of this. And when we tackle one, let's always do so in a way that builds this foundation of a strong healthcare system. Primary healthcare must work, because when primary healthcare works, we also have more prevention. When our health workers can visit people in their communities, especially at clinics and CHC levels, and when every household is known what is the common ailment in that household, we can intervene more effectively. It's only when we do that we can have a more sustained approach. We in South Africa carry the burden also of Africa. That's why Gauteng Healthcare carries the burden of servicing the entire SADC region. And we can't complain about that, Dr. Chitoka. We can't complain about that. We must ensure we do the best we can to service the patients. Health is about patients. Sometimes it doesn't matter where the patient comes from. If someone is sick, they arrive at a facility, they must be helped. We will find out later where they come from. We will find out later about other things. Health is about prioritizing people, and then the rest will follow. Whether they have money or whether they are not South African, when they arrive in our facilities, we must try and save life, because that's the oath that health workers have taken. You have taken an oath about saving life. The exact name and origin of the patient comes after. What you are keen to do, you must be preoccupied with, is to save life. After that, you may ask the patient, ubuyapi, unemali na, uyasebenza na. After you have saved the life of a patient. Thank you very much.
Thank you very much, Comrade Premier. I think let's give the Premier another round of applause. This is the leadership that we need in society to acknowledge that health does not belong to the health system, but it belongs to all of us. And each one of us, our actions count. Thank you very much, Premier. And also to just remind us that